What if something as simple as a mirror could rewire your brain and reduce your chronic pain?
Believe it or not, it can. Mirror therapy is one of the most fascinating and low-tech tools we have for retraining the brain's perception of the body after trauma, injury, or even a diagnosis with a chronic pain condition like complex regional pain syndrome. And it all started with one groundbreaking neuroscientist. Mirror therapy was first introduced in the 1990s by V.S. Ramachandran, a neuroscientist renowned for his work in phantom limb pain. He discovered that when amputees viewed the reflection of their limb moving in a mirror, their brain believed the missing limb was moving too. And for many, the phantom limb pain dramatically decreased, and for some, it even disappeared. This was the birth of mirror therapy, a revolutionary concept showing just how powerful visual feedback can be for the brain in pain. Since Ramachandran's discovery, mirror therapy has been used for more than just phantom limbs. It is now a key part of rehab for people with complex regional pain syndrome, stroke, and nerve damage. In CRPS, the brain's map of the affected limb becomes distorted, just as I covered in my previous video on desensitization, this one right here. Movement becomes threatening, sensation becomes painful. But by using mirror therapy, we can trick the brain into seeing normal, pain-free movement again without triggering real pain. Over time, this can help normalize the sensory and motor signals in the brain, reducing symptoms like allodynia, pain from light touch, hyperalgesia, an exaggerated pain response, and even dystonia, abnormal limb posturing. And I'd like to teach you all about it, but first, let me introduce myself. If you are just finding this video, my name is Chase Teagarden, and not only was I diagnosed with complex regional pain syndrome 10 years ago, but I suffered in pain for 4 years before eventually finding my way out of pain entirely. I now help people all over the world in countries like Australia, Switzerland, Ireland, Canada, and the US, just to name a few. I am bringing you this video to try and help give you solid information that you can use to help yourself move towards remission, or as I call it, recovery, from CRPS or any other condition you might be suffering with that involves allodynia, hyperalgesia, or dystonia. In this video, much like I did in my first video, I'm going to teach you a variety of techniques to help retrain your brain and reduce your pain using mirror therapy, an app that I really like to use with a lot of my clients to help identify limbs in space. I'm also going to teach you a method of using beans, rice, and sand, believe it or not, to reduce our pain and get used to new sensations. And then lastly, I'm going to teach you one of my own inventions using KT tape to help give feedback to our limbs and retrain our brain's interpretation of sensation as well. So, without further ado, why don't we start with mirror therapy? Okay, so to begin with mirror therapy, what you're going to do is you're going to place a mirror vertically between your affected limbs so that the reflection of your healthy side looks like your painful side. The reason that we need to do this and only look at the reflection is to trick the brain into believing that the moving limb, the healthy limb, is actually the affected limb, and that both limbs are moving freely without pain. What this does is it creates new, safer associations within your brain. Remember that when we have persistent pain, allodynia, hyperalgesia, or any of the pains associated with CRPS, what is happening is the brain is misinterpreting what is going on in the limb or in the body. And when the brain does that, it sends out false pain signals to these areas of the body, and that creates that lasting and confusing pain where something as simple as moving the limb or briefly grazing it with something as soft as a Kleenex causes pain. And so, using the mirror, we can trick the brain into believing that that limb is safe, and the brain, in theory, will stop sending those pain sensations. Okay, so we're going to look at the reflection of our limb, our healthy limb in the mirror, and we're going to move the limb, only the healthy limb to start, in a couple different ways. Okay, so you're going to perform some movements such as opening and closing your fist, or flexing and extending your wrist, or moving your hand in a circular motion, both clockwise and counterclockwise. I would start by doing this for 1 to 3 minutes a day. and then slowly move up to 2 to 5 minutes, 5 to 8 minutes, 8 to 10 minutes, and then gradually to 15 to 20 minutes per session, and maybe do 3 sessions a week. You can do this both with your hands and with your feet, depending on your affected areas. And in the beginning, remember, we're only moving the healthy limb. Then, as you use some of the techniques in my old video to start to reduce your pain, from there, you're going to move both limbs. And you might notice at first that when you try to move your wrist or your foot, you can't quite move the limb that's in pain as far as the healthy limb. That doesn't matter. You're just looking at the reflection of your healthy limb and you're moving the limb that hurts as far as you possibly can while still moving the healthy limb in the full range of motion. Okay, so we're moving the healthy limb in the full range of motion always, and the limb that is not, that is in pain, we're moving that only as far as we feel like we can. Over time, this will start to get easier and easier. From there, some of the things that you can do with the mirror go beyond creativity. So, if you are someone who is into baking, for example, I've had some clients set up a mirror so that they can see the cookies that they're frosting, and they will frost the cookies with their good hand, but then mimic the frosting motion with their hand that is in pain behind the mirror itself. And so what this does is it helps trick your brain into believing that all of these movements and all of these activities are safe activities. So I've had clients get creative with, drawing and using the mirror, baking, like I mentioned, and using the mirror, and many other things. Okay. Additionally, some of the things you can do in the mirror is if you have like physical therapy type exercises. So, for example, using a stress ball with the good hand, quote unquote, good hand, and a stress ball, a lighter stress ball with the painful hand. That could be a way to help build up your strength while also using mirror therapy to update your brain. So the list goes on and on with the things you can try within the mirror. And I think that is a fantastic thing to do. So, as mentioned in my previous video, when we are doing these exercises with the mirror, we are helping the brain understand that the painful limb is safe, just like the non-painful limb. And what can happen when our brain's map gets smudged from all the pain that we've been in is we can start to have difficulty even recognizing which limb is which. And what I mean by that is we might be looking through a magazine or some kind of material, and we might get confused about even our left and our right, foot or hand. And so there are a variety of ways that we can start to help the brain update and relearn where the hand is in space and identify our limbs a bit better. Remember, giving the brain as much information as possible is the best way to help the brain learn. Okay? The brain will respond to whatever training you give it. So if you give it no training at all, if you just sit in your pain and don't move, what the brain is learning is that you truly are unsafe. And in order to protect you, the brain is going to reinforce this behavior by continuing to output pain to the limb that is affected. The only way that we can help the brain learn that it is safe and stop having pain is by trying to move it in a healthy and safe way and trying to expose the brain to new information. If you are in such a state that you feel that you cannot move at all, this next app that I'm going to share with you is something that you can use to help update the brain in an easy way to start. Okay, and you can use any type of apps. Okay, there's a few apps. There's Orient, which is free. There's Recognize, which I think is free as well. But both of these apps have paid features. So when you're in this app, and I'll put it on screen here. When you're in this app, what you're going to do is you're going to do a test with the hand or the foot, or if you're dealing with both, you can select mixed. And you're going to do a test where pictures are going to flash on the screen of the hand or foot in various positions. And you're going to select left or right on the test as you go through it. And when you do this, you're going to find out that, especially if you've been in pain for a long time, it's really hard to tell the difference between which hand or foot is in that position. Even me, typically, when I try to do it, I'll miss one or two just because they're in such unique and strange positions. But by doing this over time, you will get better and better at recognizing which limb that is there. If you don't want to use an app, you can do something as simple as picking up some magazines and just going through the magazine and circling all the left or all the right feet or hands, and you will get a similar result. Okay, so the apps aren't absolutely necessary. But this laterality training is what it's called, is something that can be really helpful in rebuilding the brain's map to be in proper orientation. Okay, so that would be the next phase or another option for desensitization that you can do. And these things are not in any specific order. These are things that you can do at any time to help update your brain, and all of them will be helpful in one way or another. My next desensitization method involves using different textures to help the brain learn that touch, and especially in different environments, is safe. For the purposes of demonstration, we will use beans, rice, and sand in this video, but it is not entirely necessary for you to use these items. I have had clients use marshmallows, Orbeez, marbles, a box full of stuffed animals. It doesn't really matter. What matters is we give the brain information. Okay. This method utilizes the mirroring effect of the brain because we are putting both limbs into whatever substance we are using, be it beans, rice, sand, marshmallows, Orbeez, doesn't matter. And we are exposing those both limbs at the same time to these sensations. And so what you will do, as you can see me demonstrating here, you will place whichever affected limbs, hands or feet, into the bucket or bin that you were using and place them on top of the beans to start. If it is too difficult for your affected limb to feel the texture of the beans right away, only on the affected side you can cover the beans with something like a pillowcase so that we still feel the texture differentiation a little bit, but it is through something that is safe. Then the next step is going to be putting more pressure down on our hands or our feet into the beans themselves. And the further method is going to be to fully submerge our limb or limbs into the beans themselves as well. After that, once we've tolerated full submersion, we're going to move our limbs around within the beans. And that is the top level, I suppose. Now, the progress and pace at which I did in this video is not the pace that you'll follow. The pace that you'll follow is, maybe once a day, you try to place your foot or hand down 5 to 10 times. And this could start with on the pillowcase. Then, after a week of that, as your foot or hand starts to get used to this, you place it down 5 or 10 times without the pillowcase. And then from there, you submerge the foot or press the foot down further 5 or 10 times in the beans as well. And as you get used to the beans, then you progress to the rice and then you progress to the sand. And over time, by exposing the foot to different textures or the hand, the brain is getting used to the sensation of these textures, just like we got used to the sensation of the textures in my first desensitization video. So that is another step or approach that you can take to desensitization. Once you have gotten to a point where your affected limb can handle some sensation, okay, so learning from the first video and the techniques we went over there, as well as using the texture method with the beans and the mirror therapy and the Recognize app, what you're going to do is you're going to pick up some kinesio tape. It's called KT tape online, and you can get it from Amazon. I'll link it in the description below. And with this tape, first and foremost, you're going to cut a small strip off of this tape. So something about this size. And let's say it is your left hand that is the side that's painful. You're going to peel the tape and you're going to put it first on your right hand, so on the non-painful side. And you're going to stick it on your skin just like this. And you're going to leave it there for about 30 minutes or so. The reason we're doing that is because we want to test if you are allergic to the adhesive, okay? So first, we'll leave it there for about 30 minutes. After 30 minutes, we'll take it off. And if it's not itchy, if it's not red, then you're safe to use this method, okay? If you do have an allergic reaction, then this method probably isn't going to be for you. So if you're allergic to any adhesives, I wouldn't recommend this method. Then what we're going to do is we're going to cut equal lengths KT tape. So I'm taking this strip. It comes in a variety of strips. Okay, so there's a ton of strips here. And I'm taking this strip and I'm going to cut it into two pieces. There we go. Okay, so we've got two pieces of equal length, and we're going to take those pieces and set them on our wrist and hand. Now, if it is too painful to fully set the tape, let's say your pain is like localized to like right here or your fingers, and it's too painful to set it directly on there. What I want you to do is I want you to set it just on the edge of the painful area. Remember, we're trying to give feedback to our brain, and getting just on the edge of this painful area is going to help us get there. And that'll be just a start. And so you're going to set the tape just on the edge of the painful area, just like this. Okay. And you're going to keep it on as long as you can tolerate. For some of you at first, that might just be 10 minutes. For some people, might be 3 hours. And, 3 hours is probably the upper limit of how long you need to keep this on. But you're going to put it on. And the trick here is you're also going to put it on the side that is not painful. Okay, so this side as well. So then you have mirror image of tape on each side. And what happens is when you move around throughout the day, the tape is pulling against your skin. It's pulling like this. See how my tattoo kind of moves? And as you do that, and as it pulls against the skin, it is sending messages to the nerves there. And those messages are getting sent up to the brain at the same time, both sides of the body. And we are performing desensitization for 3 hours straight using this tape as a feedback mechanism. Okay. So you can do this mirror effect on your wrist. You can do it even on your upper arms. You can do it on each side of your back if you want to. You can do it on your legs. It doesn't necessarily have to be in the painful area. It just needs to be kind of close to it. Okay. So I've had clients, who've had pain in their feet and their whole leg was in pain. And so we put the tape on their hip. Okay, and so you can put this tape anywhere, and it is a fantastic way to independently be doing desensitization as you go about your day, typing on the computer at work, cooking a meal, etc. It is helping to desensitize that allodynia and hyperalgesia. When you go to take this tape off, it's easy for me now because I just put it on, but it can be very hard. And so what I recommend for people is to get it wet and use dish soap, not hand soap, as an adhesive breakup mechanism. Okay, so that's my KT tape method, and this method has actually been highly effective with a lot of my clients. So if you want something passive that you can do, especially on days when you're feeling low energy, the KT tape method is going to be the method for you. But don't forget, we're doing a test strip on the side that is not in pain and leaving it on for about 30 minutes to make sure that we don't get itchy or redness underneath the adhesive. If you don't, then you're totally good to go. Okay. That is the KT tape method. All of these methods are methods to help you update your brain's map when it comes to getting out of pain. Remember, the brain will respond to what you give it. A good example of this is a sprinter versus a marathoner. Okay. The marathoner here has a body that has been trained for long distance and endurance, and his muscles, nerves, tendons, ligaments, they've all adapted for an endurance race. On the flip side, the sprinter here has a body that is built for speed and explosive power, and his muscles, ligaments, and tendons, and even nerves are ready for explosive power. If they switched places and the marathoner tried to sprint and the sprinter tried to do the marathon, they would not do as well as they do in their respective sports. It is the same thing when it comes to retraining our body to get out of pain. We have to give it input and stimulus, and it will respond accordingly. Remember, if you don't do anything, your body will stay in pain. It has no reason to change. In fact, you are just reinforcing the idea that you are not safe. We need to calm our nervous system down through the various techniques I just told you about, using the mirror, the applications I mentioned, the beans, rice, and sand, and finally, our KT tape. Everything mentioned in this video is going to be linked down below. And I'm going to have two more videos coming out that are going to demonstrate some simple exercises for the wrist, hands, feet, and ankles for you to use once you get past the desensitization phase. And when I say past, I don't mean completely out of pain. I mean to a point where you can tolerate grabbing and gripping or touching things with your feet, even if it's still painful. Okay, so this is a long-term process. You're going to have days where it starts to feel better. You're also going to have days where it feels a little bit worse. Remember, recovery, as shown in this graph here, is not going to be a straight line. There's going to be a lot of ups and downs. And these ups and downs and flares that you might have if you're dealing with CRPS are happening for reasons that may be outside of physical reasons. So please don't watch these videos and think that this is the only thing that's going to get you better when it comes to getting out of pain, because it certainly is not. Remember, pain is both a sensory and emotional experience. And so the emotions behind the pain that you might be having, or the emotions related to that pain, are something that need to be explored 100%. And so if you want to explore more of that, please check out my other videos. If you are seeing this video within my online course, because I think I will include it there, please continue along the course as when you get to module 7, we start to talk about those components. And I will see you guys in the next video. Thanks so much.